following program is brought to you by the Ed Snyder Center for Enterprise and Markets at University of Maryland's Robert H. Smith School of Business. Welcome to the Ink Tank. Stay with us to get the inside scoop about technologies that could disrupt and challenge the way you do business.
Hello, I'm Christina Elson, and on this edition of the Ink Tank, I'll speak with Dr. Hon Pak, Chief Medical Officer at 3M Health Information Systems. We'll discuss how emerging technologies are enabling the widespread adoption of value-based healthcare. Hon, it's great to have you here with me in the Ink Tank today, and we're going to have a pretty wide-ranging conversation about healthcare, which is a real hot-button issue now, and I think probably will be for a while. But we definitely want to talk about what are some of the things that are going on that is allowing consumers to have a better understanding of healthcare, and how is technology helping that happen. So we're going to talk about some of the things that 3M is doing in that space. And I'm a big fan of 3M. I think they're a super innovative company, but they are a real big company, and sometimes people don't see big companies and innovation kind of going together. So let me just sort of open the floor a little bit to let you lay the groundwork for the conversation we're going to have about 3M healthcare and the consumer.
As you said, the healthcare journey started probably back in the 80s when Medicare was established, and the inpatient prospective payment system got established, not because of to improve healthcare specifically, but it had to do with the financial viability. So there was a certain amount of Medicare trust fund, as you are aware of, that clearly was over its budget because we were on a fee-for-service. And so historically, if you look back at what happened, government came in and said, based on the projection of the spending, we can no longer afford spending of healthcare to this extent. So right now, U.S. is spending about 18% GDP, and other countries are spending about a third or a half. So materially, what that means for the country is that we're no longer strategically competitive. For most people, that's like, well, what does that mean? We're still the richest country. We're the economic growth engine for the world. But if you really start looking at China or Russia or other countries that are competing economically with us, if you spend half your money or half the money that you would spend for healthcare and spend it for education or spend it for missiles or defense, you can begin to see why that matters. In addition, it has material effects, like even for 3M, where we have a global presence, obviously, for our business. But if we're spending 18% of our funds or our profit on healthcare, whereas a competing country in China or other places spending half of that, guess where that profitability goes? To R&D. So these are not just abstract type of, hey, we spend most, healthcare dollars, but it has real meaning in terms of country as a whole strategically, but also the competitive nature of our companies.
Yeah, so that's really an important point, because the issue with healthcare is definitely the growing cost. And there's also a related issue, which is that people, I think a lot of the time, if you ask someone, what is your willingness to pay for healthcare? It's been so obscured and non-transparent that it's a very difficult question to answer, because everybody is willing to pay something for healthcare, but it's an area that is, honestly, it's really just out of control, right?
It is.
So
and there's a lot of ambiguity or lack of transparency. I was meeting with Deputy Secretary Hargan at HHS yesterday, and he brought this up, that really there's an issue with consumers' inability to digest and understand the pricing or the value or the quality. And we really have to create that transparency. And that's why I think some of the disruptions that's coming from, whether it's Amazon or CVS Pharmacy or others or Amazons that are coming in and really from doing it from the context of healthcare delivery for consumers, is changing the dynamics around, hey, consumers deserve the right to know and have the data for them to make informed decisions.
Yeah, so you can think about how do you want to make the trade-off between value, cost, time, all
Well,
these
all
other
that.
efficiency, all this other stuff. But so where is 3M in that space? Because, a lot of people, when they think of 3M, they think of course,
Post-it
Post-it
notes.
notes,
Yeah,
right?
Scotch
That's
tape,
always
duct
right.
tape.
Right. I mean, they just have such cool products. But and they're always coming out with new stuff. But healthcare is a big part of the portfolio. So tell me about that.
Sure.
Hmm.
So 3M, about 30 years ago, started in the healthcare business, particularly in the health information system business, by purchasing a coding company. Because essentially at that point, we were doing everything on paper, but then you had to bill. So converting the diagnosis into some type of a code for billing purposes is how we got started. And then we layered on the classification system and bought a company out of Yale that essentially established the DRGs. And I don't know if you know about the DRGs, but essentially it's a software code by which when you go to the hospital, hospitals put you into a DRG category. And that DRG category is based on what your diagnosis is, along with your other comorbidities, and then that assigns a certain cost. And that's how hospitals get paid, with some adjustments. And so that's how we started. So we really are a healthcare content company that essentially measures performance. And by and large, we measure performance in the context of how much revenue and how to optimize the revenue for hospital and hospital settings. And then now we're moving into value. And so we're helping our customers, large health systems, medium-sized hospitals, able to really look at costs and how to drive costs out, and then to begin to help measure value and look for those things that's going to allow them to move in that journey.
So what are some of the things that are really influencing or impacting cost? Because it's confusing for a consumer. There's all this sort of stuff going on behind the scenes and systems, and it's not really accessible, and it may not be of value to a consumer, but there are potentially some aspects of that. So what is the cost aspect, and what is the information that you think it's helpful for consumers to be able to know or understand to help them maybe do a good job thinking about their healthcare consumption?
So that's a tough question, because I think we have pockets where consumers do have the information necessary. If you look at patients with rare disorders or very chronic disorders, they tend to understand how to navigate because they've gone through the system. It takes a lot of energy, a lot of know-how, a lot of persistence for you to navigate the current healthcare system. The structure of the current healthcare system is what's causing inefficiencies. So, example, we have provider organizations that are trying to document correctly, making sure that they get reimbursed correctly, and then they do audits. Payers then second guess those things, and they have administrative calls in order to see if there are waste or others. If you look at the Institute of Medicine study that was done many years ago, it shows that about 25-30% or more are waste that could be driven out. That's huge. And those things exist across provider organizations and payer organizations, along with PBMs and other players in the ecosystem. In terms of the consumer, I think as the government is beginning to think about democratizing the data, really empowering the patient with the right information, what we're challenged by is that the data is not fluid. It's not really a utility as of yet. I think we're moving in that direction. And so we have one issue of data interoperability and the right incentives for payers, providers, and other players to really make that data available, number one, but two, usable, because just because you have a bunch of data doesn't mean that it's useful. And then the third part is the outcomes and costs, right? So value by definition is outcomes that you desire over a certain amount of cost. Because if you could have greatest amount of outcomes, but if it's $10 billion you have to pay, you have to begin to say, is that worth the money or not, right? And those are individual choices at times, but as the U.S. government or any nation, you have to begin to say, at what point does that investment not worth the outcome?
Right. Is the impact too great? Yeah. And so this is where the technology is kind of comes in, I guess, and it's opening up maybe new ways to think about making useful data or creating, opportunities to collect data, and all the things, or the accuracy or verification aspects of data. So, um, you've talked a little bit about things like AI and blockchain, and even like the Internet of Things, or So, what does that look like in this real effort to try to transition into a different way of thinking about this kind of information?
So I think all those technologies you mentioned are very important in different ways. Blockchain, very briefly, will be, I predict, be hugely important as consumers receive and manage their data. Blockchain will become very critical to protect that information and make sure that it doesn't go in the wrong hands, or you have a ledger by which you can keep track of who's touching my data, right? Just like these days, if you have a financial record, you can get a service to say every time someone's asking for a background check or a financial whatever, I get a notice saying that someone's looking. And I think the same thing is going to happen. The blockchain is going to be an enabler of that. But I would say the biggest technology that we're looking at in healthcare is specifically around artificial intelligence. And right now, as you know, we have too much information. We have tons of data. And we need that size of data for us to do some very meaningful analysis around quantifying value, particularly around the outcomes. But if you look at the technologies, the artificial intelligence is probably the most promising because it begins to take these large data sets and begins to give us insights that we didn't think about. For 3M specifically, we work with large data sets, like Medicare data sets nationally, use our algorithms to begin to understand what's happening to the cost, what are the demographics, lots of different outcome variables, what are preventable, and so forth. What we're beginning to see is that the speed by which we're moving in this journey of value-based care, we can't do this manually. We have to accelerate the ability to find insights and find and define value. And in doing so, artificial intelligence or machine learning essentially allows you to take these large data sets with certain constructs and begin to then help us to automate some of that. We apply that in a very practical way. So right now we have a modal acquisition that we did just a few months ago, and that is a combination of speech recognition, natural language understanding, and then embedding in the workflow with machine learning. Part of that is the linguistic and the speech model or language model is built in so that the more you speak, the more you learn and the better precision you get. Same thing with the natural language understanding. So we are abstracting semantic level concepts of what a fever is and begin to codify that. And then the process of abstracting those clinical contexts for care gaps or for improving coding are things that are being done using those technologies. So I think every company in healthcare is looking at AI or machine learning because it's now no longer I wouldn't say it's the competitive edge. It's like if you don't do it, you're not going to be able to get to your business objective fast enough because your competitor is going to eat you for lunch.
It's interesting that you're talking about working with the government, working with large data sets, because at the end of the day, like whether healthcare delivery is through the government, through private industry, or through some mix of both, someone's paying for it. So
Right.
either we as citizens of the U.S. are paying for it, or we as private people are paying for it on the market. And the same questions apply. Like, how do we make this cost and value line up so that it makes sense, right, for us and for the future that we want to have? And we need, it's very important to have partners like 3M and other companies that are able to do this create this kind of innovative information and contribute to moving this forward. So I think that's a very interesting point. The other point is just the fact that this is becoming like a standard operating procedure. I mean, AI is like standard operating procedure, right, in the healthcare space. So what are the benefits that consumers should be seeing in the next 10 years, 15 years, if we were to look a little further out?
Sure.
What do you think we'll see?
So I suspect in about 10 to 15 years, patients' profile of sort will be stored somewhere securely. So someone will know a lot about your health and health care. And we can talk about social determinants of health and other types of characteristics that's typically outside the walls of the hospitals, but assume that somebody, whether that's facilitated by government or facilitated by a vendor, that some profile exists. And then a patient with chronic disease will make a phone call into Alexa and say, Alexa, I have a cough. And Alexa will tap into that profile and say, I know you're an ACE inhibitor, which causes cough, so we'll rule that out. But then it will know the patient and how much risk and the recent readmissions and the risk profile, and then begin to find the lowest and the highest value and lowest cost setting by which care can be best optimized. So artificial intelligence will absolutely be like the cell phone apps of the world, where it will help navigate the complexity of healthcare and direct you in a way that will hopefully get you to the best outcome at the lowest cost. It's clear that in the last 5 years, the out-of-pocket spending for consumers is increasing. High deductibles are becoming more commonplace. And for those reasons, even 3M is beginning to look at our employees globally. We have about 90-some thousand employees. And as we look at their health and their healthcare spending, while we think we're doing well compared to peers, we are beginning to say, how do we even get their healthcare better? How do we drive our costs lower? And what are the ways? And so we've looked at things like centers of excellence. Should we send patients for certain procedures that are being done at a very efficient rate and the best outcomes, and fly them there for that type of procedure, because everyone wins, right? We get the better outcomes for the employees, number one. Number two, we save money, right? And then the experience. And then the question then is the incentives. And I think this is where the whole healthcare system comes back to the fact that we are doing how we're incentivized. The fee-for-service, we're still in the volume-based care because that's how we're incentivized. So I practice 1 day a week, and right now my behavior is exactly in the way I'm incentivized. The more I do, the more I get paid. And you can say, well, what about doing the right things? But I can do the right thing in that context. But once you change the incentive, so if the patient in this case for 3M, if we incentivize our employees to say, if you go to this center, we'll help you share in the savings, right? So I think we have to get creative overall about how do we ensure that the patients makes the right decision. First is, do they have the right information?
Yeah.
And the transparency. But then the incentive has to come with that, because it's one thing for us to say, well, it's the right thing to do. But if you don't get the right behavioral change, then it's like losing weight or eating the right food. Huge impact. And as a provider, I know that 20%, 10 to 20% of the outcome of a patient is what I'm responsible for or what I can impact. 70, 80% is outside the walls of the clinic. So this is about housing, transportation, other things that I don't have control over is disproportionately impacting the outcome of a single patient. And so I think healthcare system is beginning to change the way we think about not only how we care for our patients and drive efficiency out of that 30%, but how do you spend some of that money outside and begin to really improve their health so that they don't use the healthcare system inappropriately.
The point that you're making, again, is really important. I just want to emphasize it that while we can address right now what the care the patient receives and the level of information we have about the needs of the care, there is so much that is outside of that doctor-patient aspect and even within the healthcare system itself that to your point, if we can take some of this high cost of healthcare and try to spend it on getting that better get better incentives for patients, that is a huge way that we can think about improving the final outcome. And so as a physician, I mean, I think your perspective on this is so interesting because, you are a physician. And as you said, you see patients once a week now, which is amazing to me considering all your other duties. But how did you go from doctor to thinking about these huge strategic technology issues in a really large, changing industry?
So probably the truth is that I'm a little bit of a Forrest Gump, meaning that this was not intended. I don't know that this is exactly how I planned nor thought I would make an impact. I think if you look at my career, I started in the military many years ago and then went to medical school. And after medical school, as I was doing an internship in dermatology, Bosnian War happened. And I think for most people, you can kind of see those events in your life that really began to pivot how you then made the next steps. And for me, it was Bosnian War. And I saw this person keep coming down with a folder from the 6th floor at Walter Reed. And I one day said, why is this person coming to our clinic with this folder and just coming in and out? Turned out that they were taking photos from Bosnia on skin disease or disorders like leishmaniasis and other things that they couldn't manage. They were sending the picture to the 6th floor at Walter Reed, and then someone was printing it and then bringing it down on a folder.
Yeah.
And then my chief would answer it, scribble something down. They would go up and then type something in an email, I guess, and send it back. And it then was the moment for me to say, I think there's something better.
Thank you.
Right. So that began my journey in telemedicine and teledermatology, and not because I was trained or I was qualified, but I was intrigued. I saw a problem, and I wanted to solve it in some way. So I did the outcome studies. I did software development design. I went to implement. I saw change management of how this type of technology actually changed the behaviors and why incentives are needed to, even the tools were good and showed good efficacy, it still didn't drive adoption because work increased and distributed differently than traditionally. So before, the specialist, for example, would do all the work. All you have to do is refer the patient out. In telemedicine, what happens is you as a primary care have to collect some information that typically a specialist would. And so I learned a lot about health informatics or technology and its adoption and how you bring that about to solve problems. And that journey then took me to be the first chief medical information officer for the Army. And then I got out after being the CIO for the Army Medical Department. So these were not intended, but the opportunities came. But my training allowed me to open through those doors when the door knocked.
I love the point you just made about how you can have a lot of great tools, but if you don't understand how people are going to respond to them or adopt them or implement them, then you're not doing half the work, right? And so that's something that as a physician, I think being very empathetic with your patients and sort of thinking about that aspect and then putting it together with the technology aspect has given you a very unique kind of skill set in a lot of ways. And so now with 3M, what would you say your day is like, or what are you thinking about when you get up?
So I think about a lot of things because I think, a little bit of ADD or ADHD. Uh, and I think about what 5 to 10 years looks like for 3M and our ability to maintain industry leadership. Um, my prediction is that what made us successful today, or what has made us successful in the healthcare space, and really this concept around methodologies or groupers by which we can assess risk and cost, is going to be insufficient in 5 to 10 years. I think the market's going to say, I need much more precision. And I'll step back a little bit and tell you a little bit of the story around Dr. Marcus Welby. I don't know if you heard that name or not, but it used to be a TV show when we were probably very young. And it was really about a small town where this family doctor knew everyone in that town. Not only knew them from a health perspective, but where they played, where they went to school, their parents, their families, what they ate. And because he knew all that, his ability to practice medicine and really do his very best and the best outcome worked. And in one shape or form, he was practicing personalized medicine.
Mm-hmm.
Typically, people think about genomics and all these other things as part of personalized medicine, but that's where this world has to go if we're to achieve value-based care. Right now, the problem is we know about 20% of the patients. We have no idea how patients live, how they exercise, all the other socioeconomic issues that are drivers of healthcare. And to me, I wake up thinking about how do we begin to get the holistic insight, the 360 view of the patient, and then quantify that in some meaningful and deliberate but appropriate ways by which we can predict what's going to happen and begin to intervene, right? So this is Dr. Leroy Hood's kind of Institute of System Biology, the P4 medicine, personalized, participatory, and so forth. And so it's really, to me, about how do I maintain market leadership for 3M in this space? Clearly, as you see, there are major forces right now trying to move us into this space of value-based care, not because of some notion of what good looks like, but by necessity, that we can no longer afford healthcare. But also, I think our consumers, our kids, our next generation are demanding that traditional medicine of where doctors know all is no longer true. Right?
Mm-hmm.
And so how do you now work in a paradigm where retail medicine is coming in, where primary care is being delivered in retail medicine settings, or Amazon is getting into the prescription sector where they're delivering things, and convenience and all of this and on-demand care becomes more and more commonplace. And so for me, I'm trying to understand how we at 3M make the type of changes and adapt to where the future state will be, where care will be much more on demand, much more retail, much more ambulatory, much more precision will be required, by which we can engage earlier rather than really worrying about where the inpatient and once the hospitals get admitted into the hospital.
Yeah, that's very interesting. So the business aspect of that, clearly is important. And, you and I both went to the University of Maryland, Robert H. Smith School of Business. And I think that I know it probably puts a good framework around a lot of what you're thinking. But still, it's always going back to what are going to be the needs and demands of the consumer and the customer, right? And then how how does the business need to respond to that? So that's a really a very, again, that customer driven focus that you're describing.
I think one of the issues that we have is it's not a question of are we getting to value-based care? It's about at what speed and which path are customers taking or organizations taking to get there. There's an employer aspect of it. There's providers taking their journey, payers are taking their journey, governments taking their journey, consumers are taking their journey. And so what we have is 5 different superhighways that are all going in different paths. And the question not is, will we get there? Is how will we get there? At what speed? And so as we think about all these disruptive and converging forces, how do we begin to lay products and services in the right sequence? Because if you're not careful, you may have the best solution for 4 years from now, but the market can't consume it right now because the incentives aren't there. So I think the trick isn't value-based care, yes or no. It's how do you time it and understand the changing dynamics and then being very discreet enough as to who your customers are.
Yeah. Yeah. So that opens up another question I'd like to ask, and that's for people who are thinking about, well, where do I fit into this career, because this industry, because it is something that there's a lot of potential, a lot of frustration, a lot of people who are, what could be more, important than your health, right? So what do you say to people that are looking to change into a career or looking to start a career? What is healthcare? Like, where do you think about healthcare, getting into healthcare?
Sure. I think I'll use this opportunity to plug a little bit of the Maryland Executive MBA program, because as I looked at myself and my peers, when we were just starting out and we asked the questions to get to know each other, it was surprising to me that many of us, or most of us, had not thought about who we are. So all of us had thought about where we want to go, and yet we didn't have an origination point. And this gets to the awareness of your needs and who you are and who you want to be. And Rajri really helped us to put a framework around that and had us take some time to think about who are we. And if you really begin to think about what you're good at, what your God-given talents are, along with your passion, and if you can align the love for something and your skills of something and then begin to figure that out, I find that most people have not really thought through that. And so when a young person comes to me and is interested in healthcare or AI in healthcare or specific things around 3M, I ask them more basic question of, do you know what you want? Do you know who you are? And usually I get a pause. Again, because it's a little uncomfortable for you to think about yourself and do a little self-reflection and self-analysis. And you'll be amazed how many people, even older people, our colleagues, that have really not done that. And to me, that's where, unless you know who you are, it's hard to know if you're going to succeed in whatever it is that you think you may or may not want. And that self-reflection is the first step. And once you get to the first reflection, then things like, well, I'm a kind of independent, I want to be the deep expert in a specific area, that takes career in a certain path, like research or, being able to be a really deep subject matter expert. Others, I find, want to impact the system. And so those tend to be more public health or policy people, or they want to manage an organization. So I think there isn't a canned answer. Clearly, the impact that we can have in healthcare is what drives these people from a meaning perspective. And I find that the younger generation really care about that purpose. And so I don't have to talk a lot about why healthcare is important. Everyone gets it. It's really a matter of what in healthcare do you want to do? And, just separate from the individual, self-reflection, I would say the hot areas are cyber, AI, big data, and within healthcare space. And so if you can take some combination of those along with like public health, I think you'll be in good standing regardless of what happens. What's hard for me when I give advice is that I don't know what their journey is going to look like. Only they will have to find out. And so all I can say is, what are the tools that I would take with you or pick them up as a way along that journey that equips you best, regardless of where it takes you. But I think the first thing is back to the self-reflection of who you are as a person, what's important to you, what you value. Because I think in the decisions of where you work, because it's one thing to say, I want to accomplish this. Then the question is, in what setting do you want to do that? Small company, large company, nonprofits, right? Or small entrepreneurial. And different people have different characteristics that align them differently based on their risk-taking profile to the desire to have, position, money, and so forth. So I think it's a wide-ranging conversation typically when someone comes in and they want to drink after I'm done because
it's reflective, deeply reflective, right? Yeah. And no, I mean, and thanks so much for saying that, because Rajari Agrawal, who teaches in the executive MBA program, one of the things that she and I have done is actually recently create a class, an online class called Creating a Purposeful Life and Career, that tries to help people think through some of just what you mentioned. And so, because you're right, it is about matching, thinking about your skills and abilities, and then how do you want to leverage them? Where do you want to leverage them? But it's awesome that you are having those conversations with young people, because you really do have to stop and think about it. And not just young, at any age. I mean, everyone goes through transitions and wants to reevaluate. Is this where I need to be? Let me do all that again, And so that's the, as you said, the first point to anything, any future success. Yeah. This has been a great conversation, Hon, and I will look forward to following you at 3M and continuing to learn about all the great things that you're doing there in terms of delivering value-based healthcare for consumers. Thank you.
It's great.
The rising cost of healthcare is one of the most critical issues we're facing today. Technology can help create a more transparent and holistic approach to healthcare delivery while lowering costs for the consumer. Thanks to Dr. Hon Pak for talking with me today. Until next time, this is Christina Elson in the Ink Tank.
Subscribe to the Ink Tank on Spotify, Google Play, and Apple Podcasts. A special thank you to the Kauffman Foundation for their support. From the Robert H. Smith School of Business at the University of Maryland, thank you for joining us in the Ink Tank.